Our culture tells us that when we are ready to have a baby, we will get pregnant. Many men and women who experience infertility have described it as the most upsetting experience of their lives. Common reactions of individuals and families to this issue are feelings of grief, anger, and depression. They also face lessened self-confidence and decreased couple livelihood. Guilt, shame, and a loss of personal control in their lives haunt them.
If you do an overlay of fertility, it's going to count for all of them. Sex, power and control, money, leisure time. Often you see a pacing issue, so that the women, often about a year ahead of the men, know that something is wrong or they want to get started on treatment. So they're running down the road, and the men are back here often saying, we're okay, we're going to be all right, let's just have hope and be positive about it. So that creates conflict between the two. She's feeling held back, he's scared to go forward. If we add then money on top of that, is this about the fertility problem itself? Is this about who wants a child or who does not? Is about who's ready, who's not ready? So you get this kind of tension. Gay couples are much more open in their definition of family. So the notion of creating family, family of origin and the family of creation, with gay couples, it's just a much broader expression of family creation. With families, which is one of the ones that I was talking about before, people want to give a grandchild to their parents, but it's not a gift that they can give with ease, so there's shame and guilt. And there's also, are the parents going to accept the child? Sometimes the parents just don't care. Sometimes, well, that one's a really hard one, because then everything that ever happened in that family of origin is now coming here, right in this moment. Now we're bringing a child into the same dysfunctional mess that their parents they're not supportive. Like, oh, that's good, or that's nice, but they don't help. They don't ask questions, or they're invasive with their questions, so there's often boundary issues around it. Often, especially the women will be crying in this office because they just want to have a good conversation with their mothers. The women often need to go talk to a girlfriend. As much as we would like our men to be girlfriends, they're not. So girls need to talk with girls sometimes. Men do not need to cry for women to feel better, although that gets talked about in here a lot. But they do need to indicate that they're present in some way.
With any treatment option available today, couples trying to get pregnant can face a long road ahead, not always leading to success. In addition, certain treatments may cause various changes in behavior. This often causes additional dynamics between a male and female couple.
Oh, is your partner having some distress? Please ask. Please tune into your partner. It's not uncommon that relationships will break up over fertility issues. And I suspect that it's because there have been some other issues. A way of really rallying around somebody in a family to say, we've got your back, and to just listen. If people would just listen when somebody's in distress, that's powerful. In couples, sometimes one person is more extroverted, one is more introverted. And so one wants to talk and process with other people because that's how they do it. And others like, shh. So we have to find a way for permission for the one who needs to talk, has somebody to talk to. And I think for the one who isn't talking at all, we encourage that one to say, please, can you talk to somebody? Because it's too much pressure between these two people. And it doesn't need to be that way. And what I usually find is that when people do finally open the door just a little bit, it's just we don't have to carry the weight of this by ourselves. I wish people would talk about it more. I don't really understand the taboo of it, because it's not something that someone has done. It's not, I used meth, so I have a fertility problem. This is a medical problem. And insurance companies say that fertility treatment is optional. these are medical issues. These are happening in someone's body. And I wish that people would really step up and say, we are having a medical problem. We want to add to our family. We need your support. Please be kind. Please stop being judgmental. Please tune in to people's distress.
Infertility is a much more common issue than many people think it is. It isn't often talked about among friends, families, and social circles, leaving couples to suffer in silence. The possibility of waiting years or even a lifetime without expanding one's family can be unbearable to imagine. Advice, even when well-meaning, won't fix the problem and can cause anxiety. What a couple struggling with infertility really needs is unwavering support and a listening ear from their friends and family. Let's get rid of the stigma and talk about infertility.